Recently, I'll use an actual case study without using the name because I don't want to create any HIPAA violations of confidentiality. A client did this, and he kept 88% of his in-network patients. 88%. Let me answer the question just point blank right here, and then we'll talk more about it.
Mm-hmm.
Is it possible that when you resign from PPO plans, that your income could go down? And the answer to that question is yes. That's certainly a possibility. I've just never seen it happen. Now, that doesn't mean it couldn't happen. I guess if you did everything wrong and simply didn't have the circumstances in your practice that would even allow you to consider that, then possibility of your income going down. I've just never seen that happen in my coaching work. I've never seen that happen. That's a fear, and I get the fear. The fear of that is, well, Gary, I already feel like my budget's pretty tight. Most dentists on PPO plans feel like they're not making enough income. And
Yes.
the reason is they're handing 45 to 50% off to the insurance company. So it's pretty uniform that I'm already not making much money. It's all relative. It's not like you're in the soup line or anything, but it's like, hey, I'm not making much money and I couldn't remotely afford to have it go down. And if I drop plans, is it going to go down? So it's like I'm already underfunded with my income.
Yes.
And if it goes backwards, it's going to be worse. And I don't want that.
I would rather stay where I am than take that risk.
Right. I'd rather, deal with the devil I know than the devil I don't know.
Right.
And the reason why your income isn't where it should be is that you're handing 45 to 50% of those treatment fees for PPO patients straight to the insurance company.
So let me ask you some follow-up questions, Gary. You said you have never seen that happen in your coaching work.
No. And in fact, if you look at this for just a minute, I just want you to run the math through with me if you're a listener on this. One of our goals when you drop PPO plans is to keep as many of your existing patients as possible. Recently, I'll use an actual case study without using the name because I don't want to create any HIPAA violations of confidentiality. A client did this, and he kept 88% of his in-network patients. 88%. Now, would you agree that's a pretty darn good end result?
Yeah, absolutely, Gary.
By the way, he was ecstatic. He was ecstatic about that because he said, I thought I'd lose way more.
I know you tell people they could lose 10 to 15%, right? So this person is kind of on the high end, meaning they did really well.
Yeah, they did well. He kept 88%, lost 12% of his patients. So now run that in reverse. That means he is getting 100% of his fee on 88% of his patients.
Right. So
100% of his fee on 88% of his